Hello, it's Dr. Rhonda Johnson. Today I'm talking about home tests for gonorrhea and chlamydia. So folks, this message is about two common sexually transmitted infections, and if this is something you don't want to hear, please keep scrolling. Now, did you know that it's easier than ever to be tested for sexually transmitted infections, gonorrhea and chlamydia? You can buy without a prescription over-the-counter home collection tests for these two common sexually transmitted infections. Now, according to the CDC, chlamydia and gonorrhea are the first and second most common bacterial STIs, that means sexually transmitted infections, in the United States. In 2021, that's the last year for which data are publicly available, there were an estimated 1.6 million cases of chlamydia and over 700,000 cases of gonorrhea. But one thing you can be sure of is these numbers most likely represent an undercount. Now, here's a fact that half of all STIs in the United States occur in young people between the ages of 15 and 24. What's contributing to that? Well, I'm not sure, but we know that condom use has decreased, and the use of substances may also be a contributing factor. So what do you think is causing the increase in STIs? But back to these tests. No prescription is needed. The person using the test needs to follow the instructions and test according to the instructions, as well as follow up on how to get the results. But a quick overview of chlamydia and gonorrhea. What are they? Well, they're both bacterial infections, usually transmitted during vaginal, anal, or oral sex. Now, many people don't have symptoms with these two infections, but if they do, the symptoms may include pain or burning with urination, pain or burning with sex, lower abdominal pain, especially in women, swollen or tender testicles, or abnormal discharge from the vagina, penis, or anus. And women can have vaginal bleeding between their periods. Now, both chlamydia and gonorrhea can be passed during birth, during the birth process, if the mother has it and she's not been treated. Now, speaking of treatment is easy. For both chlamydia, it's with oral antibiotics. For gonorrhea, treatment can be a shot or oral antibiotics. Now, gonorrhea can be a serious and life-threatening infection because gonorrhea can gain access to the bloodstream and cause infections of the joints, and that's called septic arthritis, and life-threatening blood infections. Now, if you or your sexual partner have symptoms of an STI, please see a healthcare provider as soon as possible. Now, if you have been informed that your sexual partner has chlamydia or gonorrhea, CDC guidelines indicate that you should be treated with antibiotics. So in some areas, there are free or low-cost clinics operated by health departments or community health centers. They can do STI testing as well. Well, that's my message today. As always, take care, be well, and, get those home tests if you think you need it.